years ago, when this question about the API economy, the Uber example you outlined, there was no industry consensus on how Epic and Cerner and others, forget the health plans, no one ever asked them to do anything, by the way. There's no regulatory requirement for them to have any APIs yet. By the way, stay tuned for the CMS rules in about 10 days. In the period from 3 years ago till February of 2017, Epic, Cerner, Allscripts, Athena, McKesson, Meditech, et cetera, all agreed on how an open API that is performing consistently, the system said we're ready to go. I would argue if you went to the day before the Apple announcement, the number of health systems that had hit production, go, on the patch or the upgrade necessary to meet that spec was dramatically lower than the level of effort required to turn it on. The day after Apple Health, boards of directors started calling CEOs and said, why is our institution not on the list?
Yeah, happened to me.
It did, right?
Well, and then I said, because Apple won't support pediatrics, but that's a whole
That's a different issue. But here's my point. The beauty of that moment was that CIOs started saying, okay, new orders, I got to connect. What is that 6-hour level of effort? And it happened. It's not a technical barrier to Uber having SendGrid, et cetera. It's cultural and adoption. And as soon as the meaningful use for plans comes out, which I'm going to guess is, I said 10 days, Seema Verma all but said, health plans must open up a Fire API, she said, to consumer apps. So that means the exact same infrastructure that is there will now be on the plan. So plans and EHRs, combined with all the wonderful things John has done, I can't tell you how excited I am for the future of healthcare.